Hey, this is Erin from Educated Nurse, and I'm doing a lecture series on what it was like to go from an ER nurse to a breast cancer patient and back. Lecture number 10 in this series is Treatment is Done. Yay. If a sniffle equals a cold, does a headache mean meds to my brain? And all the worries and fears that you have and what it's like life after cancer treatment. I do want to put a disclaimer out there that this video is for instructional purposes only. All right, so you just survived cancer. Now what, right? Over the course of my diagnosis and treatment, I had over 140 appointments in 1 year, almost one every 3 days. You get used to seeing your doctors and nurses. You feel safer because you're constantly being monitored and checked on. In a strange way, I felt sad leaving on my last day of radiation because I'd seen my nurses and doctor every day. And afterwards, there was this void there. These people have come into your life, hopefully for a short time, and you get to know them and they get to know you. You take an interest in one another. It's kind of like a sick, dysfunctional little family. But then treatment stops and you wonder, what do I do now? Right? I remember lying on the table during my last radiation treatment and I started crying. I couldn't believe it was over. All of it. 9 months of tests, procedures, and treatments. It was all done. Like always, my husband was by my side and he comforted me. He understood my tears, knew that they were happy in nature, but also knew my very emotional response and why I was having it. Again, I asked myself, what do you do now? You live. That's what you do. You go on living. Yes, you'll have this lifelong relationship with oncology, but gone are the weekly appointments. Now you'll go on a 3, 6, or 12-month schedule. Cancer is scary and the fear of reoccurrence is real. Follow-up appointments can create a tremendous amount of anxiety. I'm 8 years out and I still get anxious. But you have to trust that all these months of treatment were worth it and the path you took killed that frickin' cancer. Easier said than done, I know. I struggled for a couple weeks not knowing what to do or how to feel. I wish the doctors and nurses would have stayed in touch a little more in the transition period instead of just cutting me loose and wishing me luck, kind of like don't let the door hit you in the ass on the way out. I felt lost at times. I was so used to having someone there to reassure me, I began questioning every little thing. It's like my rational and more specifically my nurse brain stopped working. It got easier, and I remembered being at work, back with friends, back in a routine, and I caught my reflection in the ambulance bay and I saw my short hair. I couldn't escape the fact that it all happened. I felt like for a while anyways, there was constantly taking care of oncology patients in the ER. The reminder was everywhere. For a while, there's a transition period where you have short hair and people stop and stare and wonder why you decided to have a meltdown and shave your head. You could say that you went to a beauty school on the first week of class and this haircut was so bad this was the only option. You could say your kid put gum in it and you had to cut it short. You could also tell them the truth, but really, just be ready for a slew of questioning, even for strangers. When the time is right, take off your scarves and wrap and let the wind whip through all your little baby hairs. Go to the grocery store, touch the cart handles, sanitize later, of course. Venture outside and get a little sun on your cheeks. Take a vacation, you deserve it. As life went on, I got back into my routine. Moments of anxiety creeped back into my life. I was nervous to get sick, so I continued to have hand sanitizer everywhere I went. I washed my hands at work all the time, and I washed them so raw that they began to peel. The fact is, your immune system takes a big hit with chemo and treatment, so my concerns were valid. However, it shouldn't have taken over my life. Easy to say now, but in the moment, it was terrifying. A month after I finished radiation, I got sick. I was scared shitless. My mom and brother came to my rescue and kept me entertained as I sat in the radiologist for about the 20th time that year. I started feeling burning in my chest and I was short of breath. I knew I was high risk of blood clots being on tamoxifen. So, of course, my doctor wanted me to have a CT scan. I went in for labs, which were normal, and a CT. The good news was that I didn't have a blood clot, but the CT did show that I had damage for treatment. My heart was enlarged from my heart having to work hard post-chemo, and there was evidence of damage to my lungs. I also had pneumonia. I was told it wasn't common to get pneumonia post-radiation, but honest to God, if I would have been If I ever would have followed the statistics, in retrospect, I should have bought a lottery ticket every time someone told me the statistics of my cancer. Less than 1% of people get cancer under the age of 40. Well, I was 33. They told me if I would have gotten pneumonia, it would have been 6 months after treatment. Or if I would have had damage to my lungs, it would have been years. Or damage to my heart, it would have been years. Well, here I was 1 month after treatment, and I had already had this damage. When they ask you about fears, it's not the bees and spiders or snakes kind. Fear is there, and it's always real. For me, it took a few therapy sessions to understand that while the concerns are valid, they can't really consume you. I found that if I kept myself busy, I didn't think about cancer as much. It was when I was alone or with my kids that I thought about it. I often thought about how much it would have taken away from me and how much I vowed to never let that happen. Looking back at my fears over time, rationally I knew that a sniffle didn't mean the flu. It was probably just a cold. Pain in my chest may have just been pain, indigestion, or pulled muscle. It wasn't a heart attack or lung cancer. A headache didn't mean that the cancer was back or mets to my brain. The thought crossed my mind, but it wasn't true. Fears will always be there, but you have to trust in the process and your doctors. You've put yourself through hell. It's normal to feel that way. I met some pretty amazing cancer warriors during my time, and it was remarkable to see how many of them were success stories in living beyond cancer. It's always positive to hear survivor stories. I also met some truly wonderful people who lost their battle and passed away. People I think about often and miss. I trade places with them in my mind sometimes and throw myself a pity party, but my amazing family usually brings me back to reality. I had a hard time not thinking about all the what ifs, but I had to continually remind myself, will it change anything? What will it change? Will it change treatment? Will it change the plan? Will it change my life? Those were often answered with a big fat no, and reality comes back. But after treatment, people would say to me, wow, you look great. Aren't you so happy that you're done with this whole cancer thing and cancer's behind you? And I remember thinking to myself, you really have no clue about this whole cancer thing. But I would smile and say yes to be polite. Honestly, it never truly goes away. Cancer is always there. Maybe not physically, but in your mind. There's not a day that goes by that I don't think about it. Follow-up appointments will continue, and you'll have a lifelong relationship with your oncologist. It's not like strep and you take a pill and you're cured in 10 days. I wish. But really, cancer was part of our lives, and it's not what defines us. We have to be ready to be able to write the next chapter. Cancer was a struggle, but it's important. And things that I've learned is that it's important that you go on living your life. Don't let cancer take you away from the things that you want to do and the people that you love. Don't let cancer take away one more day. Have a pity party, but set a time limit. It's not uncommon to have a flood of emotions as you begin to mentally process everything. But don't let it diminish all the hard work you've accomplished on your journey. Celebrate life's little moments and find joy in every day. One of the best quotes I found said, "Dear Cancer, thank you for making me stop and listen and remember what's truly important. You can go now." I know it's hard, but try not to let your thoughts consume you. This is my tip. Cancer is everywhere. Just when you think you've gotten away, you hear of someone else being diagnosed. Stay positive, stay the course, get your life back. Go back to work, play with your kids, go on dates with your significant other. Take time for yourself. Your body's been through hell and back. Give yourself a break and be kind to yourself and figure out your meaning to life. And like I said, going through this process, I've learned cancer is everywhere. I found it extremely powerful to document my journey and pay it forward. If I did hear of another woman being diagnosed, I sent a care package of things that I found helpful during my journey. I also completed random acts of kindness. And that just felt good. You'll find that you'll struggle with how to thank everyone. The ones that are with you day in and day out, they won't do it for the thanks, but I know I always wanted to try and say thank you. Towards the end of radiation, I started walking in an attempt to get ready to go back to work, and being an ER nurse, it wasn't uncommon for me to walk 3 to 5 miles in an 8-hour shift. I knew that while I was resting and napping to heal during treatment, my muscles were getting weaker and weaker. I had to get back on my feet and get moving. One morning I was walking and the sun was out There was a nice cool breeze, and I was listening to the song Humble and Kind by Tim McGraw. The last line hit me hard to the point of tears rolling down my face. In the song, he says, "When you get where you're going, don't forget to turn back around, help the next one in line. Always stay humble and kind." The next one in line. The next cancer warrior. I decided in that moment to share my journey. I wrote a book to cope. I wanted to share my feelings and be transparent with everyone around me. I wanted to raise awareness and educate, and over time I thought maybe my story and humor could help someone else, but I wanted to share my experience and hopefully help the next one in line. And even it just made someone laugh, that one person would be enough. Thanks for listening to my lecture series. I've got one more on how to advocate for yourself. But if you know someone that's struggling with breast cancer, hopefully you can share this series with them. And even if you're a nurse or healthcare provider, hopefully it just gives you a little bit of, shed some light on things that you could do for your patient. If you want to learn more, check out my book. I wrote this while I was going through cancer treatment as kind of for a way for me to process things. And I found afterwards that it actually could help other people. So my book actually goes into a lot more details about my journey and just some tips and tricks that I learned along the way. You can check it out. It's available on Etsy, in my Etsy shop, and on Amazon. Thanks for listening, and make sure to check out the other videos in this series.